Healthcare is something everyone needs, but not everyone gets the same way. Even in the same city, two families can have completely different experiences with doctors, bills, and treatment. In the early 1900s, there wasn't much of a system at all. People paid doctors directly, hospitals were simple, and most care was local. After World War II, everything shifted. The government froze wages, so companies started offering health insurance to attract workers. It helped a lot of people, but it also created a divide. As costs rose, the government stepped in. Medicare and Medicaid were created to support seniors and low-income families. Later reforms expanded private insurance, regulated hospitals, and modernized medical care.
The United States is one of the five wealthiest nations in the world, and despite spending the largest or the highest amount in healthcare, the US is faring worse than all of the wealthy nations. The biggest reason we struggle to provide healthcare for all is the cost and the unanswered question of who is going to pay for it.
Hospitals in wealthier areas usually have better equipment and more staff. Meanwhile, clinics in low-income neighborhoods are often underfunded and overcrowded.
In Monterey, a lot of patients have very good insurance. In Watsonville, a lot of patients are either uninsured or underinsured. And what it means, no insurance, no health care.
There are four main ways that Americans get health insurance. The first is Medicare. This is a government-funded program where folks over 65 get health insurance. The second is work-based health insurance. This is where your employer pays most or all of your costs for health insurance. The third is ACA, Affordable Care Act or Obamacare, which went live in 2010. This covers about 24 million Americans and is a government-funded discount for individuals to buy healthcare. And the fourth is Medicaid, which is a government-funded health insurance for people who make less than a certain amount. There are about 80 million people, or about a quarter of the country, that benefits from Medicaid at this point.
If a child is born in a homeless family and the child has no access to healthy foods, child is living in not healthy conditions, and child is not able to access good education, that child will never ever reach the level of education that will then translate into a well-paying job, and that lack of well-paying job would also then translate into a lack of insurance, and that will then translate into lack of good access to healthcare.
This year there's a new law that passed called the One Big Beautiful Bill Act. Its impact for healthcare is going to be really big because at the beginning of 2026, when it takes effect, two big things are going to happen. Number one, the ACA subsidies, those discounts that 24 million Americans are getting, those are going to go away. Number two, the number of people who qualify for Medicaid health insurance is going to go way down. A worry about this new law is that health insurance costs are just going to keep going up. So the way insurance works is that you pool money to pay expenses. So let's say this year there are 10 people that bought health insurance and 2 people got sick. The expense of taking care of those 2 people is shared among the 10 people that paid insurance. Now with these new changes, healthcare is going to be a much higher ticket item. There are going to be some people who say, hey, I'm healthy, I don't need to have insurance, and they're not going to even buy insurance. So now you might have 7 people paying into the pool and 2 people still getting sick. Now those expenses are going to be shared among 7 people, and you know what? Those costs are going to go up.
Healthcare inequality isn't just numbers or politics. It affects real people every day.
There are 3 ways that regular people can help make a difference on this issue and on issues like it. Number 1, spread the word. Make sure your friends, your family, your neighbors understand the implications. How is your life going to change because of a bill, because of a law? Number 2, write to your congressman, right? Make sure that your elected representatives know your opinion and know the impact on the people they're supposed to represent. And number 3, vote.